Hi guys, if you want to know the important topics for your INICET upcoming exam in general surgery, I have brought an easy way for us to decode it. Now, I'm going to tell you about what are the important image-based questions, the important classifications, important malignancies, and the topics that you need to revise before going to the exam. Now, in the image-based questions, drains are absolutely important. They love asking you the images of the drain, their mechanisms. The favorite is Jackson-Pratt drain and Romovac drain. Do not forget about it. Cannulas, color codes, flow rate, everything they've asked you. Foley's catheter, they've asked you the sizes, color codes, and obviously what is the French means. All the swellings which are going to be on surface. Their favorite is your angular dermoid, right? That is one of the simplest and the most frequently asked question. Instruments, all basic surgical instruments. We have a list of it. Just go through them. It's just one view. You just need to go through and then everything will be sorted. Then you have important classifications. Their favorite classification is CEAP classification of varicose vein. They've asked you again and again and again. Then it's the Forrest for upper GI bleed, bile duct injury, both Strasbourg classification, Bismuth classification, Hanover classification is important. Bosniak for your renal cyst, Nyhus is for your hernias classification, and Fontaine's is for limb ischemia, that is for chronic arterial occlusion. All of them are important classifications that you need to remember. Then the important malignancies. Breast cancer, you have to know the TNM classification, staging and management. Thyroid cancer, management. Oral cancer, TNM classification. Colorectal is going to be both your TNM classification and management. HCC, remember the BCLC criteria, that is Barcelona criteria for liver cancer and its management. Gallbladder cancer, your TNM classification is their newfound love, and obviously the management. RCC, again, you need to remember the Robson's classification and the management. Testicular tumors, the whole component of seminomas, non-seminomas, germ cell, non-germ cell, everything in terms of management is important for testicular tumors. Now, remember the important topics. The list of the important topics just for the disclaimer is not very long. It's only 23 topics that you need to remember. The most important, I've started from the breast, that is Andy classification, thyroid, that is toxic thyroid swellings, goiter classification, WHO classification, all of important. Primary assessment in trauma, the 11th edition of ATLS is important. It is not now ABCDE, it is XABCDE. X stands for controlling the exsanguinous hemorrhage, and that is an important update. Then you have thoracic trauma, solid organ injuries and spleen and liver is important, damage control surgery, your Bosniak hernia, that is congenital diaphragmatic hernia, motility disorders of esophagus, esophageal perforation, peptic ulcer disease, inflammatory bowel disease, hereditary cancer syndrome, that is going to be your familial adenomatous polyposis, Gardner syndrome, Turcot syndrome, Cowden's disease, and Peutz-Jeghers syndrome. Fistula, aneurysm, thoracic outlet syndrome, varicose vein, total parenteral nutrition, again a very important topic. Cholecystitis and cholecystectomy, your hepatocystic triangle versus Calich triangle, the safe dissection, everything has been asked. Chronic pancreatitis, Tigaro classification of previous exam question. Nephrolithiasis is their favorite question. Bladder and urethral injuries, hydrocele and inguinal hernia are the topics that you need to look before going to the exam. And then comes the tricky topics. Now, in the tricky topics, usually they will ask you in depth about burns, surgical site infection, cleft lip and palate, repair criteria, parathyroid adenomas, from the diagnosis to the management, and most importantly, the investigation of choice. It is going to be system wave scan. The best is going to be 4D CT. Do not forget about it. Pheochromocytoma, absolutely love it. Neuroendocrine tumors, from the appendix to the carcinoids. Every single question they've asked you from before. Mesenteric cyst is their love topic. If they want to goof up, they actually go with mesenteric cyst. And the neurotrauma. EDH versus SDH. All the brain, traumatic brain herniations, your diffuse axonal injury, all these are their favorite topics. So this is the list of topics that you need to know with respect to your INICET. You cannot afford to lose on it. See, approaching an INICET exam is quite simple. Make sure you have done your previous year topics and the questions, you know how they're asking it. Concentrate on those topics. Mostly all of them is listed right across here. Your job is to now go and do that last 5 sessions of INI general surgery questions and revise these topics. And trust me, you will not be disappointed in the exam. Not only that, a simple tip, from now onwards, do 200 questions per day till you the date of your exam, and that will have an immense impact on the outcome as well. So all the best for the exam. And just if you have any other questions or queries, reach out to us. And I'm Dr. Sandeep, your general surgery faculty, hoping to listen from you soon, and make sure you do your exam well. Thank you.